What to ask your family genetic counselor. If you are getting ready for a session with a family genetic counselor, you might be wondering what questions to ask. This is a great opportunity to gather important information about your family's health. Let's go through some key questions that can help you make the most of your time. First, ask about the counseling process. You might want to know what to expect during the session. It is also helpful to find out how many appointments you will need. Make sure to ask what documents you should prepare, like your family health history or any previous genetic testing results. If genetic testing is part of the first session, inquire about what kind of sample will be needed. Next, discuss your family health history and risk assessment. Ask how the counselor will assess your family's risk for hereditary conditions based on the information you provide. It is important to know which details about your family health history are most relevant to share. You can also ask how the counselor handles information from both sides of your family. When it comes to genetic testing, you should ask what types of tests are available for your family situation. Understanding the benefits, risks, and limitations of these tests is essential. Inquire about how likely it is that genetic testing will provide clear results or useful information. Additionally, ask how you will receive and understand the test results. It is also vital to discuss the implications for you and your family. You may want to know how the results could affect your health management and that of your family members. Ask how this information might impact your children or other relatives. Privacy is a significant concern, so inquire about the protections for your genetic information. You should also ask if genetic information could affect insurance coverage or lead to discrimination. Cost is another important topic. Be sure to ask if your insurance will cover genetic counseling and testing. If not, find out if there are financial assistance programs available. Understanding the costs involved if you choose to proceed with testing is also crucial. If you or your family have had genetic testing in the past, ask how current testing might differ or improve upon those results. You may also want to know if you should consider retesting with newer technology or expanded gene panels. Finally, ask about next steps and support. Inquire about the follow-up care or support available after counseling and testing. It can be helpful to know how to share this information with your family and what resources are available for communication. You can also ask if the counselor recommends any specialists or support groups for hereditary health concerns. To prepare practically, gather detailed family health history, especially regarding hereditary conditions like cancer. Note who was affected, the type of condition, and ages at diagnosis. Providing any previous genetic testing reports can make your counseling session more effective. Understanding how genetic information may affect your family dynamics and privacy is also important to discuss. By asking these questions, you will be better equipped to make informed decisions about genetic testing and understand how hereditary health factors may influence your family's medical care and planning.